Have you ever, as a healthcare professional, been a patient before where you have had the healthcare professional that you're working with told you things like it's all in your head, you're just assuming things, and basically just invalidating and dismissing any concerns that you may have? This is what we call the 101 of medical gaslighting, something that we have explored before on this channel. Now, I am going to look at certain examples of a very specific form of medical gaslighting that occurs more common than others, and that is going to be in the female health and reproductive care. So in this video, we're going to cover some examples of that, as well as the reasons, as well as how we can prevent that as healthcare professionals. Welcome back to my channel, everybody. Thank you very much for joining me every single week. My name is Shweta and I'm the founder of Healthy Dynamics. We are a coaching practice that helps healthcare professionals whose English is not their first language, but they speak it quite fluently at an intermediate level. Healthcare professionals who are either working in an English-speaking country or in a setting where predominantly their patients are English speakers, native English speakers, and they want to improve, and you as a healthcare professional want to improve your English fluency as well as your overall communication skills in order to get better connections, better referrals, better testimonials, and overall progress in your career quickly. So if you fall under that category and you are a healthcare professional who works with patients on a regular basis, you absolutely come to the right place. So medical gaslighting is something that I have explored in this channel before, particularly and specifically in the case of menopause, when women get to that stage. I'm going to leave a link to my playlist as well as a specific video towards the very end of why I talk about why medical gaslighting does take place when towards menopausal patients. We're going to look at a much more broader examples or that covers more detail and more depth in medical gaslighting in female reproductive health care. Now, you may not be an OBGYN who specifically works with female patients, but regardless, even if you are a GP, even if you are a pain management specialist, even if you are an endocrinologist, this knowledge is very, very imperative. And the reason being that female reproductive health has been something that has been really, unfortunately, not given the due credit and importance, and has that much knowledge and awareness as healthcare professionals need to have. And so that's why it's imperative that you watch this video to get a better sense of my perspective, regardless of how often you work with female patients. Now, what actually inspired me to make this particular video was a podcast I listened to named Audacity, and a couple of weeks ago they did an episode on medical gaslighting. I'm just going to leave a link to that over here as well as in the description box below, so you can have a listen of what the context for this one is. And basically what they looked at was some of the history behind why women's bodies are treated as basically inanimate objects. Women are just not valued or acknowledged or heard or respected or listened to by healthcare professionals. And they also looked into the concept of hysteria, which if anything, if you want to learn more about that, there is a lot of information on that podcast episode if you want to check that out. But a very simple definition of medical gaslighting is what I'll give you right now, which is when a patient's symptoms, pain, or concerns are minimized, dismissed, or disbelieved, especially when no clear diagnosis has been found. So instead of, say you, for example, you can be a GP and your patient is coming to you and saying that they are experiencing pelvic pain. And instead of, and they may be of a certain age, whether they might be of childbearing years or maybe they are getting to the stage where they are menopausal or getting to that point. Instead of working with the patient and getting to the bottom of what the cause of the problem is or of the pain is, some of the things that healthcare professionals would normally say is it's normal, you're overreacting, it's pretty common for your stage of life to experience this, it's a symptom of your stress. A very common one is it's because you weigh a little bit more than how you did when I saw you last time, and you'll be fine, less weighted out. And in many instances they'll just give them a pill and just give them painkillers to just numb the pain as a short-term solution. Now, this can be unintentional, and it's not often about bad healthcare professionals who just don't care about you. A main reason why this happens is bias. It's about communication gaps. And it's also not knowing how to say, I don't know, but I believe you. So not being aware of how to acknowledge and validate your patient's challenge. Women, especially women of color, disabled women, and non-native speakers, experience this much more disproportionately than our Caucasian counterparts. And one of the most frequently gaslit areas in modern medicine is the female reproductive health. And last week's video, I did look at one example of where this happens, but you will also learn about more examples when you look at, check out that episode of Audacity. But I'm going to go through some examples of, very common examples of medical gaslighting that women go through when in the hands of their healthcare professionals. Number one is chronic pelvic pain or endometriosis. My own friends who got diagnosed with endometriosis much later in life experienced this firsthand. So their pain was very, very often dismissed and invalidated by not just by GPs, but also endocrinologists and OBGYNs and even pain management specialists. So they really have to, they had to really jump through a lot of hoops and get to the point of even getting the healthcare professional to give them a proper testing and diagnosis, which happened so much later. All they got at the receiving end was that they were just, this is just part of them being a woman or just a symptom of bad periods, instead of really getting to the bottom of it, which was very, very disheartening and distressing for them. So this is an example of gaslighting when the patient's experience is dismissed without any investigation, or when they're made to feel dramatic or weak. A second very common example of where this happens is pregnancy. So when a woman is pregnant, that's a whole, they face gaslighting all the time, unfortunately, during the very first stage of conception, from when the pregnancy is confirmed to the point where when they're going through their regular scans and things like that, and when a patient is, say, going to their OBGYN and saying to them that they're expressing something is not quite right. The fetal movement, the movement of the fetus in the uterus is feeling quite different, and there's just an unusual level of pain and swelling and all the other symptoms that pregnant women experience. The most common clapback that the way in which healthcare professionals gaslight patients in that situation is that they're probably anxious and stressed due to the pregnancy because of the hormones, and they just offer them not only painkillers but also tell them to rest and relax. And I'm not saying that pregnant women shouldn't do that, but instead of going into more invasive tests, in a safe manner, this is what they get with, and this can sometimes, unfortunately, has led to really bad, severe consequences like late-term abortions and even stillbirths and late-term miscarriages. And that is something that could really easily be prevented if they were heard and taken into consideration. Also, another huge one, I'm just going to attach that with this one, is the postpartum mental health. Now, we all know that postpartum depression, anxiety, psychosis is very common after women give birth, and when they go to their GP or things like that, and to get any sort of help or support, they would normally just say that it's just the baby blues, everyone experiences it, you'll get through it. And whereas really, postpartum depression or anxiety, and all those symptoms are very real and very common, and intervening, testing, and treating them early can really be a life-saving example. The third example I would say for medical gaslighting is something that I personally have not experienced, and it's what actually making me hesitant to go down that path, is when women, regardless of whether or not they have had children or they choose not to have children, when healthcare professionals deny them of getting sterilization. Usually women like me who've chosen not to have children, healthcare professionals, they will tell them, if we approach them and say, listen, I've made the choice not to have children, I put a lot of thought into it, I want to make sure that this does not, I never face the problem of an accidental pregnancy, I want to get permanently sterilized. And there's plenty of resources, plenty of videos of that all over YouTube and everywhere else, which you can check out. I'm planning to get one of the OBGYNs who actually, on this YouTube channel, who actually does this very, very willingly. I've heard her on a lot of podcasts. But in this situation is what you would get in in healthcare professionals, what they would say is that you're going to change your mind. What if your future husband, or your existing husband, or a husband who doesn't exist, what if he wants kids? What if you regret it in the future? Things that really dismiss their intelligence, insult their intelligence rather. So that's another example of where very classic case of medical gaslighting happens. Now let's look into some of the reasons why this even exists. Now, like I mentioned in the very beginning, this is not because healthcare professionals don't want the best for their patients. That's not the case whatsoever. But there are several other reasons why this actually happens. There are four very common ones. Number one is implicit bias, which I've looked at quite a bit of on this channel and on LinkedIn. So women's pain and just women in general throughout history, their bodies and just how they function have really been have never been taken as seriously as that of men's, especially when there is no viable cause. And that's what actually leads to these concepts like hysteria or mania that women experience because they're not taken seriously, and it becomes much more catastrophic. And this risk actually multiplies when you have language and cultural barriers. Number two is time pressure. So obviously healthcare is a very, very intense and busy work environment. So there's always a subconscious rush for healthcare professionals to move on if there is no immediate diagnosis. So instead of taking the time to diagnose and get to the root of the problem, and what can happen is this can really lead patients to feel invisible or unheard. A huge and significant one is knowledge gap in women's health. Now, the video I did on menopause last year really highlights this. So things like not just menopause, but things like endometriosis, adenomyosis, or PMDD, the amount of research that has been done on them is very, very low. And as a result, healthcare professionals are not as trained or up to date on how to handle those cases as they should be. And that is why there's such a push now, more awareness and more training in healthcare professionals so that they can actually get a better understanding of these conditions that are common in all women, and they can treat them appropriately and give their patients the support that they deserve. And the uncertainty of not knowing something can actually make a healthcare professional quite uncomfortable. So in a situation where I've mentioned this in videos before, where a healthcare professional gets a question and they don't feel confident about what exactly to say or how to answer that question, so they minimize the concern instead of saying that I believe you and we can look into this together. They do this to sound confident, but in other words, it just ends up backfiring altogether. This is something we need. I was very called to make this video because this is a very, very real concept that happens all the time, and it really harms patients' lives and destroys them, but it is preventable. So even if English is not your first language, you have the power to make every patient feel seen, heard, and respected. So it starts with you listening without judgment, validating before diagnosis, and speaking with warmth and curiosity, and showing that open-mindedness, willingness to diagnose and get to the root of the challenge. So you don't need perfect English to be a powerful communicator. You need empathy, intention, consciousness, and awareness. So let me know in the comments down below what you can do as a healthcare professional in the future to avoid or prevent medical gaslighting when it comes to interacting with your patients. So stay tuned for more videos on this and several other concepts on how you can become a better communicator as an English as a second language healthcare professional. Make sure that you hit the subscribe button and the notification bell. Leave this video a like if you do like it wholeheartedly. And as always, thank you very much for your time, attention, and presence, and I shall see you next week.